Awesome. And I'm going to go ahead and start the PowerPoint. Welcome and thank you so much for joining us today for preparing for postpartum. As you all know, you've seen me here before. My name is Lelena Rabari. I am with Team Mom Cozy, and we are thrilled to be welcoming Kim Updegrove as our presenter here with us. For those that you do not know, Mom Cozy, we're all about being cozy. And when we talk about cozy, it means a lot of things to us. It's about listening to our inner voices, being authentic who we are, finding the strength to achieve what we desire, remaining true to ourselves, no matter what life stage we're in. And I know that's easier said than done as we're all transitioning all the time into different life stages. But we have a phrase here called cozy power. And to us, that is about all the love that we extend to you, all of our amazing moms, so you can be exactly who you are, a woman, a wife, a friend, so much more. So that's Cozy Power by Mom Cozy. So we've been around since 2018. We started pre-pandemic with nursing bras, and then we've expanded our product line, and you all likely know us about the wearable breast pumps. I'd love to learn about your favorite Mom Cozy products, so feel free to pop that in the chat as well. We've grown now. We have 3 million users in 40 plus countries and growing. And our goal is to be a companion for you from pregnancy up through early motherhood. So maybe some of you used our pregnancy pillows. Some of you are going to use our wearable breast pumps, our lactation massagers, our nipple cream, our baby safety items. We really want to be here for you. And this is a part of our breastfeeding support program. This program kicked off in August. And a part of the program is to provide moms with accessible evidence-based education. We all know how challenging sometimes it can be to find education, especially when you're in the throes of trying to prepare for a baby. So we're here to provide that to you. We have our online community. We also have a lactation consultant scholarship fund. If you received your IBCLC certification in 2022 or 2023, please look in our Facebook group. We have a scholarship to help provide you exam reimbursement. And here it is. This is our QR code. So make sure to give it a scan, and I will add you after this webinar. But after this, Kim is going to be answering questions. There's a specific post in that group, in the Facebook group. So feel free to pop your question there if it is not answered. Throughout the webinar, I ask that you use the Q&A feature. We are going to get to questions at the end of the webinar, so it's hard to look through the chat. Use the Q&A feature, please. And if you join our community, we'd love to have you. It's all about encouraging one another. Upcoming events. We are going to have in-person events soon, and we're really trying to cater the content to your needs. I know it's hard because all of us have different needs when we're in different stages of motherhood, but the more we participate and contribute, the more we can meet your needs. And joining us today, you have a chance to win a postpartum essentials recovery kit with all these wonderful goodies. We have wipes, we have those beautiful diapers for you, the Perry bottle, we have some soothing cream, et cetera, et cetera. So we're excited to give those away, and we will announce the winners a couple days after our webinar today. All right, without further ado, I'm going to welcome Kim Updegrove. Kim has dedicated her career to women and children's health. As a certified nurse midwife and registered nurse, she served as faculty member at Yale and the University of Pennsylvania. She's ran her own private midwifery practice and provided support to breastfeeding families across 25 states in her role at the Mother's Milk Bank at Austin. And she is so committed to maternal and child health, and she is saving babies' lives, supporting women all over the world. She actually just got back from Belize to open a women's clinic there. So we're so grateful for you, Kim. Welcome.
Thank you. I am so excited to be here, and so excited to see the list of participants and realize how many of you are about to be brand new moms. And whether you call yourselves a moms already, just the fact that you're pregnant, you're a mom. You are definitely cooking your baby. So as we get started, I'm just going to point out to the host that the PowerPoint doesn't seem to be progressing. So you might need to reload that and make sure that it goes.
Oh,
But let me talk about what I hope to cover. What I
is it
really
working
hope
now?
to cover in this. Perfect. Good. I see the agenda now. So what I really hope to cover is postpartum adjustments. You know, I bet that since many of you are pregnant with your first, and even if you're having your second, third, or 10th, you've probably gotten some prenatal education. You've probably read 1 or 12 books, if you're like me, and you've probably, hopefully, attended a class that has you prepare for what a lot of people think about as the big day, the labor and delivery experience. And there's nothing wrong with thinking about and preparing for the big day. But the big day is just one day, probably a 24-hour period. And then comes all of these days, hopefully 100 years of days, where you are embracing a new role. So you have body changes and you have emotional changes and your whole world and identity has changed. So I want to talk about some of those things in the brief time we have together. And I want to talk specifically about breastfeeding and how that affects the adjustments, what that does to health and to stress, and why infant feeding ideally is breastfeeding. And then we'll talk about some other coping mechanisms and how you can build that positive relationship with your baby. So we'll go to the next slide. I had to slip in one cartoon here, and it's with a message. So you see a random person saying to a mom with a new looking baby, "Hey, do you need anything?" And she says dutifully, "No." But look what's going through her mind. I need a home-cooked meal. I need a shower. I need a break. I need time to myself. I need some sleep. On and on and on. And that shouldn't scare you. It's something that happens every day, every single day across the world, because I have a worldwide perspective. 385,000 babies will be born today, and then tomorrow, and then the next day. So it's a common shared experience, except that everybody's experience is different. And whether you did it once before or 10 times before, or this is your very first time, none of it's easy. None of it's the same. Those of you who are having your third or fourth or fifth or sixth know that every pregnancy is different. Every postpartum period, every baby is different. Everybody's reaction around you is different as well. So we get to start over and learn fresh every single time. And guess what? Women are strong, we're adaptable, we're flexible, we can do it. Yes. Just have to acknowledge some very key things. So it's fair and honest for you to say, it's common, but it's not easy. I have stresses, and yes, you can help. And I want you to start now training yourself to say, yes, you can help. I need help. Even if then you have to stop for a second and think, what do I need help with the most? I can remember thinking, okay, if I had 15 minutes, I would not feel crazy. So if you could hold my baby for 15 minutes and I could take a shower all by myself and maybe sit down and eat a peanut butter sandwich at the same time afterwards, I would feel good. And so train yourself now to say yes and figure out what you need the most later. So on the next slide, I realized that this slide doesn't look as fun as a cartoon, but let's just talk about what's happening postpartum, because while you're focused on how you're going to respond to the labor and what labor is going to feel like, and why is it called labor and not picnic? That must mean that it's going to hurt some. Well, how much is it going to hurt? You know, these things going through your mind. And how's the delivery going to be? How's that first glance at baby going to feel for me, for a baby, for any support person in the room? You could keep thinking about all those things, but There's nothing that's going to make the postpartum time period go smoother than actually understanding that the postpartum period is a real thing, and it requires adjustment and planning. It requires some things to be in place, and learning to say yes to those people who say, hey, is there anything I can do for you? That's just the first start. So if you think about how long it's taken you to complete a full-term pregnancy, it's 40 lunar weeks, right? Or what we say in communities is 9 months, even though it's really 10 lunar months. 10 months to get to where you are now. It's not over. You're going to birth that baby and you're going to have some physical feelings and reactions. I mean, initially you birthed a baby. So whether you gave birth vaginally or you needed a C-section, you're going to have cramping and bleeding. The uterus has done a great job for you. It's expanded, it's practiced contractions, it's allowed the baby to be in its little aquarium of amniotic fluid, and then it's opened up the cervix and allowed you to push out the baby. Well, it's going to take some time. It's not going to be back to its pre-pregnant state for 6 weeks. So during that whole time, the muscles are going to contract so that it can reduce back to its pre-pregnant size and stop the bleeding. That's going to be the heaviest in the first few days and then slowly taper off. Giving birth vaginally means you're going to have some perineal discomfort. We don't often have 7, 8, 9 pound babies coming through our vaginal canal. It's going to cause some discomfort, and that is the biggest euphemism that I can ever imagine. For most people, there'll be little tears. Maybe there'll be an episiotomy. But even the best nurse midwife with great control of that perineum is going to see that there's actually been a little bit of damage there. That takes time.
Oops.
Go back one more
Sorry
slide.
about that.
Good, perfect. So that all is going to happen. And if you have an incision from the C-section, that's going to take time to heal. You're going to have that checked multiple times in the first couple of weeks, and it is going to heal. But that's major abdominal surgery. We go through skin and through muscles, and we separate those things, and then we open up the uterus and we repair all of that. But it takes time for the body to repair itself. So hemorrhoids might be a thing for some of you. You're carrying a baby that's sitting right on your perineum, putting pressure on your rectum as well. That baby's in an aquarium, so it has additional weight of that amniotic fluid. You have a placenta feeding that baby. Those are all really great things, and that's a lot of pressure. And so hemorrhoids happen, and that can be additional discomfort. Your hormones are changing drastically. So in pregnancy, your estrogen and progesterone levels and your prolactin levels are protecting your pregnancy. They're allowing you to stay pregnant, and they're allowing your breast tissue to change and get ready for milk production. In the immediate postpartum period, that's changing rapidly. Really rapidly. The estrogen and progesterone are decreasing while oxytocin and prolactin increase tremendously. This causes a lot of changes, and whether you have decided to breastfeed or not, your breasts are going to feel some discomfort. You're going to very likely experience some engorgement. And so that swelling and pain in your breasts as you prepare to make and release milk is a real thing. And it's probably the last thing that you want to experience as you are holding your baby, but these are real things, and it's good to think through, all these things are going to happen to me. What might I need to make that journey a little bit more comfortable? And how can I take the pressure off of myself to be a certain way, act a certain way, look a certain way, while you're experiencing all of these issues? Your hormone changes are not going to even out for 3 to 6 months. Lots of different factors affect that, but that means that you're in this for the long haul. This isn't a 2-week checkup that says, oh, you're back to normal now. You can go back to work. You can do anything.
Thank you for saying that.
Right?
Yeah.
It's a challenging time. So emotionally, it's not all about the hormones. It's not all about the hormones because each of us has an identity and each of us has expectations of ourselves. And each of us has a differing level of sensitivity towards every single person in our life, whether it's a close-in figure like a sister, or just the random person walking down the street who might look at you and cast some judgment or make a statement. You're allowed to be an emotional person because we're humans. We're physical and emotional and social beings, and the emotional part of us separates us from all of the other mammals. So allow those emotions to take place. It isn't just the hormones. It's really about who you are. Acknowledge that your whole identity has changed. You took on a new label if it's your first time having a baby. So now you're a mom or a mother or a parent or however you identify yourself. But there are also other emotions. We can't help as human beings to think about our own mothers and how they felt when they gave birth, and to think about our circle, and to look at somebody else and say, well, she seems to be coping better than I am. Maybe I need to buck up. Or, I never knew how to cook anyway, but now it's my baby that's dependent on me, and breast milk is ideal in that first year, but then I'm going to need to learn to make some meals because I don't think I can get by relying on others or restaurants or whoever has been providing food. So let me put some pressure on myself. These emotional
now, let's start cooking.
real, so very real. And there's a thing that sort of crosses physical, emotional, and social impact. And that's the fact that babies are not just a full-time job. They're a 24/7 responsibility. And responsibility is a big statement. You are responsible for carrying and birthing a baby, but it doesn't stop there. Unless you are caring for someone else, you're a surrogate mother, which the responsibility is still to yourself. Unless that's true, you have a primary responsibility to make sure that that baby's needs are met, their basic needs and their higher needs as they grow. So there's a lot going on, and there are lots of things to cause you to feel emotionally destabilized.
Yeah.
And then socially, if you have a label that you acknowledge, your CEO, your sales representative, you are volunteer of the year with this community group, you just changed your identity. Maybe it's temporary. Maybe you're just on a postpartum maternity leave from work for a few weeks or 6 weeks or 3 months. But it's that temporary change that really changes who's around us. If your social support comes from the 2 people whose cubicles are near you, you're no longer near their cubicles. So building social support and identifying ahead of time who is going to be able to help you with this transition is very, very important. Identifying what I call as a breast friend is important. Someone who's going to support your choices for feeding your baby and be there as a resource, providing maybe just their anecdotal stories, or maybe they're a healthcare provider or a scientist and they can provide some clinical data, but you choose in advance, how are you going to deal with each of these things? And how are you going to surround yourself with the people and the things who will support the choices that you make? Let's go to the next slide.
I'm glad you said that because you can look at that list and go, oh my gosh, what did I get myself into? But I promise you, as somebody who has had a child, there are words and things I didn't even understand. And when you're going through them and you don't have language for them, it can be very challenging. And so she shares these things not to scare anybody off, but we're here to offer you some of the insight so you don't feel so alone and so strange that you're going through these things, and to have grace for yourself. So I just wanted to interject there. You go ahead. I just wanted to make that quick note.
No, I like that. None of this information is to scare anybody. If pregnancy and birth and raising children were scary, we wouldn't have 385,000 people.
We never do it.
Doing it.
Yep, we love it.
Yeah, and it is a wonderful, joyous time in your life with some things that might stress you if you're not prepared.
Right.
So by attending this webinar, you are informed, and that's a major part of being prepared.
Absolutely.
I can't talk about the postpartum period without saying, for a tiny small percentage of people, there are things that happen that are called danger signs, reasons for you to seek a healthcare provider's care immediately. And that means that if you on day 1 after giving birth have this level of pain, and instead of decreasing each day, it's increasing, or you've got a fever, you need to seek care. If your bleeding postpartum is decreasing, then you're perfect. But if it suddenly starts to increase, and it's not because you just decided that you needed to meet your goal at 2 weeks postpartum and walk for the first time 2 miles around the neighborhood, that will lead you to have increased bleeding. It's your body's reminder that, hey, I'm still recovering here. So please start slowly and take it a block or 2 at a time. If instead there's persistent or increasingly heavy postpartum bleeding, seek care. There are some things that could be going wrong. Headaches, persistent swelling, those things are not normal. Maybe they're related to not being hydrated or eating well enough or sleeping when your baby is sleeping, but let a healthcare provider figure that out. Seek care. Don't be sorry later that you waited a long time. If you're having difficulty taking care of yourself and your baby, and in the worst case, thinking of harming yourself or your baby, these are real reactions for a tiny percentage of people in the postpartum period for whom the depression is not just baby blues, but true postpartum depression. Seek help immediately. Next slide. All right. As somebody who works for a milk bank, I'd be remiss if I didn't talk about how breastfeeding factors in. Most women make a decision about how to feed their baby by about the 6th month of pregnancy. So I bet that most of you have a plan. And that plan can change, but you're making a plan so that you can be educated, so that you can have the supportive equipment or resources available, so that you can prepare your social circle for what you anticipate doing. You get to choose. But I want to make sure that you are ready to breastfeed successfully, if that is your choice. Breastfeeding is an important decision to make. It is the ideal way to feed an infant. It protects you against certain cancers, against diabetes. It protects you against significant blood loss immediately postpartum. A whole host of benefits to mom. But it protects the baby. We're mammals, and all mammals make milk to feed our infants, and that milk is ideal for that infant. It's made specifically for them. And so babies who are breastfed have far fewer respiratory infections. They can process the milk very readily, absorbing all of the good nutrients and use that for growth and development. They also are receiving your immune factors, your antibodies that protect the baby against everybody else who wants to see that baby and breathe something on that baby. It's cold and flu season.
Yeah.
And COVID's here to stay. So people want to breathe on and touch baby. Give your antibodies to the baby by breastfeeding. There are some things that your body is doing to get ready for feeding your infant. And hormones, again, come into play. So as the estrogen and progesterone are protecting your pregnancy, prolactin enters in here too. And that's changing your breast tissue. You might see that your breasts have increased in size. You might see some vascularization. You might see some blue blood vessels that you didn't see before. A darkening of the areola, maybe an expansion of the areola, lots and lots of changes. That's prolactin doing its job. As the estrogen and progesterone drop after you give birth, prolactin increases, and that allows the milk production. And the oxytocin that's working to help your uterus contract and get down to that pre-pregnant size is also helping the milk to be released. Critical when you are expecting to breastfeed, whether you are breastfeeding solely or whether you are intending to breastfeed and pump or express some milk. Critical is that your interaction with the baby begins right after birth. Skin-to-skin contact with that baby is what stimulates the prolactin and oxytocin that then stimulates the milk to be produced and released. For most of you, when that baby is placed skin to skin with you, no matter if you give birth vaginally or by C-section, that will begin the stimulation of the milk, but it doesn't mean that you will have milk present at that time. For some of you, you're in that last couple of weeks of pregnancy and you might be stimulating your breasts and your nipples, and you're already seeing some very early milk that we call colostrum, loaded with proteins that are immune protective benefits to the baby. Really, really good for baby. And if you're seeing it before you give birth, save it. Just take a little tiny cup, like a medicine cup, and save those drops and put them in the freezer so that you have them ready for your baby. You might also ask for some syringes from your healthcare provider without needles and use the syringe to suck up those drops. Place those in the freezer.
Oh, that's
you
wonderful.
can take them out of the freezer and thaw them very easily when the baby is born. Baby needs to have your milk at that point. But that skin-to-skin contact in those first moments gets that process stimulated. And for most of you, without milk present or milk visible at that time, know that that's stimulating your hormones so that the milk can start to be available to that baby.
I'm glad you mentioned this because it can be feeling really defeating. I think after you have your baby, I expected this rush of milk, and it is coming on. So please be patient. I know some people have the colostrum before, so don't freak out. It is coming. As Kim shared, our bodies were meant to do this. So I really appreciate that slide, Kim.
Indeed. Actually, go back to the slide and I'll mention one more thing. There's a very interesting expectation that many moms have, and that is that their infant needs to eat on day of life 1. So day of life is this fancy way we have of marking time. Day of life 1 means the 24 hours after your baby was born. Your baby has been drinking your amniotic fluid, learning how to process things, keeping its intestines and stomach moist, and stimulating some development of those things. The placenta has been feeding the baby. So you haven't had to put a spoon in the baby's mouth or put your nipple in the baby's mouth. The baby has been fed by your placenta, and now the baby is born. The baby is most awake in that first 1 hour postpartum. So having the baby skin to skin is not actually all that happens at that time. The baby is opening its mouth, maybe crying and maybe not. It's just the only language the baby knows after all. But that baby is, when skin to skin, smelling you, hearing the heartbeat that that baby is already familiar with, smelling your milk that you might not yet see come out of your nipple, but that baby is smelling it, smelling your nipple and your areola, getting a sense of, oh, this is where I'm programmed to be. I am ready for this, even without the milk there. That baby's stomach on day of life 1, remember, in the first 24 hours, is the size of a marble. And it's going to be a marble throughout the first life. So while a peanut butter sandwich might sound good to you, that is far bigger than a marble. That baby does not need you to produce a cup of milk.
Yeah.
Baby needs a drop or 2, and
Yeah.
that's it. For most babies, that drop or 2 that progressively increases over 24 and 48 and 72 hours is all the baby needs. When that baby has a need because of blood sugar that's dropped a little bit too low, or bilirubin that's a little bit too high, some hospitals like to intervene and give the baby an intermittent feeding when your milk is not yet available. And for many hospitals across the United States, 30% of them by the CDC's recent survey, they're offering donor human milk in that brief moment of time. Not a cup of it, not a bottle of it, but drops of it. That's all baby needs.
Oh.
For many other hospitals, they're offering formula. Even if you have a breastfeeding goal, they're giving drops of formula. I have a lot to say about why that's not the right thing to do. Human milk is the best thing for the baby, but that's a different talk. You can advocate for your baby to receive human milk ahead of time by making sure that you are stimulating your breast, declaring your breastfeeding intent, and making sure that your healthcare providers present at the birth of your baby know that you want that baby skin to skin. You don't need that baby to be bathed, wiped off. That baby can be stimulated while that baby is on your chest or abdomen. It can be stimulated to breathe and to pink up, as we call it euphemistically. In other words, to transition from fetal circulation to infant circulation out in this world, separated from the placenta. You can advocate for those things.
Love it.
All right, now we can go to the next slide. Good. So postpartum preparation. Hopefully we haven't scared you away, because, you know, the postpartum period is going to come just like labor and delivery are going to come. But labor and delivery are one point in time. Postpartum is going to extend for 6 weeks for your uterus, 3 to 6 months for your hormones. And I'm going to tell you, as a mother of children in their 30s, it's going to extend for decades. This sense of motherhood and your need to be responsible in that role. So education, formal education, yes, take classes by all means. And those of you who are going to deliver a baby in the next 2 weeks or 3 weeks, don't take a class. Talk to everybody in your social circle. Yes.
How'd you do it? How'd you do it? How'd you do it?
Yes. Talk to people who've been there, who've done this. Their stories are anecdotal, but their stories are really critical. Keep talking to them. Get a sense of how wide the array of solutions are. And then know that you, as a problem-solving mother-to-be, can figure it out. Have a plan to meet your most basic needs and the baby's most basic needs. You are still a person. You have to eat and sleep and drink, and you need to have a plan for what to do with your uterine bleeding. And you need to have a plan for how to support your growing breasts that need a really nice supportive bra, ideally. And you need to have a plan for the baby. Where's the baby going to sleep? And how's the baby going to eat? And are there enough nappies or diapers in the house? And wet ones? And on and on and on. Basic needs. You don't have to think about what wallpaper needs to work in a nursery, or painting your kitchen, or what toys need to be around. You don't need any of that. Think Maslow's basic needs. Just meet those. You can't do any of it if you're not prepared with good food and hydration for yourself, comfort measures for yourself, fresh air and sunlight, accepting help from anyone. I lecture my patients to wear their bathrobe for 2 weeks. I don't care if you're the most professional, serious person in the world. If you wear your bathrobe for 2 weeks, you're reminding yourself that, oh, you're recovered. And you are easily making your breasts accessible to your baby. And you're reminding everyone else around you that you are recovering as well. And therefore, when they come, even if it wasn't the plan, their plan was just to look at the baby, who somehow must be looked at in the first 2 weeks.
Must be visited.
Exactly, which I urge you not to do, or at least to limit. But it's a reminder to them to say, oh, right, oh my gosh, let me make dinner for you. Let me put the laundry in the washer, or fold the laundry that's been sitting on this couch for 7 days, on and on. That's what will make you successful. Preparation. Don't let it be just for the labor and delivery, but let it be for those postpartum period, and you will be surprised by how resilient you are.
So I feel like a lot of people are going to just start getting their bathrobes right now, start purchasing.
Yes.
Get them right now, ladies.
The bathrobe that speaks to you the most.
There you go.
Indeed. All right, next slide. And so extra stressors, and I've said this, but I can't emphasize it enough. This is not a full-time job. And anyone in your circle who's saying, hey, it's a full-time job, just be ready, it's a full-time job. It's super adorable, but whose full-time job is 24/7? We all get time off, right?
Yes.
But a baby, a motherhood job, taking care of a baby is a 24/7 job. It doesn't mean you have to do it alone. There are certain things that only you can do. Breastfeeding that infant is for you to do. Taking care of your postpartum body is for you to do. But someone else can hold the baby while you shower or sleep. Or maybe you want to read a book. Maybe you want to walk around the track at the local high school because that's what you're used to doing, and that will help you feel good. Most importantly, because we are emotional creatures, there's always an inner negative voice. There's always something that says, the house is not clean enough. I am not showered for 3 days. I don't have clean clothes on. Listen to your inner negative voice for a minute. Acknowledge that it's there. And then put it aside. Say, hey, inner negative voice, I just gave birth. I grew a baby. I am taking on a new role, and I am choosing to take that on, and I am all powerful. So hello, inner negative voice, listen to my positive voice, and you just keep at bay. A particular stressor in many postpartum people's worlds is listening to others. People around us who mean well, who want to be supportive, take on a tone or issue a judgment that can be so harmful. You're not going to change them. This is not the time to yell at your dad and say, Dad, you know nothing, breastfeeding is best. Or Mom, or best friend. Instead, Listen for a second and then say, hey, and I personally like to hold up my hand and just say, hey, that's ouchy. That's not helpful to me. I know you don't mean that. I need all the positive vibes. So
Yeah.
put aside the criticism. Help me out here.
Mm-hmm.
You have no one's expectations to meet except for yourselves, your own expectations, and touch base with those expectations. Make sure that they are reasonable expectations, that you're not just listening to your inner negative voice saying, I gotta be dressed every single day, and I've got to fix my hair and put my lipstick on. No, you don't. Absolutely not. You need to take care of baby, and you need to take care of yourself. Scheduling things to happen. Your best friend is coming. You're 10 days postpartum. You're going to have lunch. She's going to bring lunch. And yet, your 24/7 responsibility, when you count back, gee, over the last 24 hours, the baby was particularly unsettled because the baby can't read and the baby can't look at a calendar and the baby doesn't know we have this thing scheduled. So the baby has said, yeah, I'm not going to sleep in this 24 hours and I'm going to poop all over everything and I'm going to upchuck a bit of that milk, not for any particular reason, just because this is my day. And you're going to look a wreck. Put aside the schedule. A best friend understands that today is not the day for sitting and having a nice lunch. Today is the day for that best friend to show up and not even say a word about how you and the baby look. Leave the lunch on the table, do some laundry, change the bed, help you to get into the shower, put the schedule aside. No schedule. Postpartum time period is dictated by your own body's response to your physical, emotional, and social changes. So let your body dictate that and let your body be in charge of the schedule.
Well said.
Next slide. Okay, so we've covered a lot of this. One thing that I have to emphasize is that when you have a baby, and it happened to me, and I bet it happens to most people, everyone in the family and the inner friend circle needs to see the baby right away. But do they? Because the baby was just born. So the baby is transitioning to this extrauterine life, to this environment where there are lots of germs and there's lots of people breathing and exposing the baby to viruses that the baby wasn't exposed to before. They don't need to see the baby. The baby is still going to be the baby at 3 weeks and 4 weeks and 5 weeks. You can delay those visits, except by those people who are enormously helpful, who come in and have tasks to help you. Don't get dressed. Say yes when people want to help. Allow you to make the choices for the baby and for yourself. You had probably a work experience and you have some plans for returning to work. Allow them to change. I just had a staff member at the milk bank say, hey, I know that we can take 12 weeks off or 16 weeks off, but I want to come back at 10 weeks and I'm going to be ready. And I'm so ready. And then she emailed the week before and said, actually, we're having a little sleep issue, so I need to delay that for a week. And the answer is yes, she was taking charge of her life and she could have delayed it multiple weeks. Take charge. There are some of you in positions where you can't take charge. You can't dictate when you go back, but figure out what you can take charge of and make those decisions. Be empowered to make it what you need it to be. In other words, be flexible.
I do want to add here one quick point. When you are on maternity leave, what happens at your office is it's not your problem anymore. And that was so hard. Sometimes I see moms emailing me when they just had their baby. And I always remind them, please, it is not your problem. It is not your issue. So if your workplace is not telling you that, I'm going to be here to tell you that your number one job is to there for yourself and to be there for your baby and your family. And guess what? If things are on fire, that's okay. They're going to be on fire, but that's not your responsibility at this point in time. That may feel a little harsh to say, but I just really, I want you to embrace that, because life goes on in a business and organization, and it will go on without you. I promise it will be okay.
I love that you mentioned that.
Yeah.
So in your maternity plan, you're not only planning for labor and delivery and postpartum, you're planning for who's taking your responsibilities.
Right.
You're not in charge of what's happening at the workplace.
Yep.
So you outsource all those things that must happen during that time period. Don't give in to that cell phone or that meeting that just must take place, and so you have to jump onto Zoom. Don't do it.
Yeah.
You are
And
absolutely not responsible.
And I also want to preface this here in the postpartum period. You're going to feel tempted, and you are transitioning into a new person. So a lot of this may not make sense until you're in it, because you're going to still, those pieces of who you are, you want to still stay plugged in. And I think there's a real fear of missing out. There's a FOMO factor because you see the world on social media going on without you. So give yourself grace too. Those feelings are just going to happen. And as your baby is going to demand more and more from you, I think the FOMO may dissipate to some degree.
You are so right. You're speaking to
Right.
those role changes. Embrace the role changes.
Yes,
You have
absolutely.
new titles to incorporate into yourself. It is important to know your rights and obligations in every state, every country, etc., has different rules in advance. Know what your medical insurance requires in order to acknowledge the baby. How is the baby receiving coverage in the first couple of days, in the first couple of weeks, and how is that changing? What kind of paperwork do you need to fill out? Do that at 6 months and 7 months pregnancy, not the day after the baby is born. Assign that to a sister, to a partner, to somebody in your life whom you trust to investigate those things. You want to know in advance, when do you need to be seen for healthcare? And when does the baby need to be seen? Depending on how you gave birth and what's going on with you and with baby, you might need to be seen in 2 days after leaving the hospital. You might need to be seen in a week. It might be the next day, and it might be every day. It's very, very different. Talk to your healthcare providers and know in advance what are the expectations.
Mm-hmm.
You want to know, based on where you are and what you're doing, where you're allowed to breastfeed and how do you want to do that. In the state of Texas, where I reside, you have a law that says that you can breastfeed anywhere where a mother and a baby are welcome. Well, that means different things in different places, and it doesn't mean that other people are going to point or say something derogatory or say something supportive. Be prepared for that and know what your rights are so that you can counter any conversation or comment that feels uncomfortable. And know in advance, are you a person who would love to cover up with a fancy cover up so that no one can see that you're breastfeeding? Or are you someone who feels comfortable in not covering or hardly covering? Decide in advance what will lead you to feel comfortable, and know that that will change over time as you and the baby become breastfeeding best buddies.
Mm-hmm.
Know that traveling, because I'm thinking about holidays and about families who need to see babies and families with young infants who will choose to travel rather than have people travel to them. Know that the airlines have become more supportive, but each one has different rules. So if you're going to fly on a plane, contact the carrier you will be with and ask them their rules. They're all very, very different, but you have the right to be there. They just might dictate what kind of carrier the baby's in, or whether you can breastfeed openly, lots and lots of things associated with them. And then be prepared for surprises. In the US, You can travel on any of the airlines with your baby, and you can bring your expressed breast milk on that plane. And yet there are stories almost weekly of individual airports where the travel agent just wasn't as informed as they should have been. That made mothers open their breast milk bottles, taste their breast milk, maybe discarded their breast milk. There are horrible stories. Know your rights and make sure that the people around you are supportive of those rights. If you know the laws, then you can protect yourself and your body.
And a really good resource for that, everybody, is United States Breastfeeding Committee. They're a wonderful advocacy arm of breastfeeding. So please write that down, United States Breastfeeding Committee. They have wonderful literature online for you to understand your rights in your state. So I did want to note that.
Indeed.
All right.
All right, we're getting to the final.
Yeah, we have a couple questions too. So
good. Know yourself. Listen to your body, not your negative inner voice, but your body. If your body says this part of me hurts today, pay attention to it. Especially pay attention to your level of bleeding. It should decline over time. Your milk supply, it should increase with the demand. Your weight loss or weight stability. If you're eating well, you should not be losing weight. We don't want postpartum women to return to their pre-pregnant weight too quickly because you need 500 extra calories to support breast milk, and that's a very, very critical. Dizziness is not normal. It could mean dehydration, it could mean malnutrition, it could mean a whole lot of things going on. Very important to acknowledge it. And your mental state is harder to assess, but it's absolutely critical. You feel like you can't get out of bed, you can't get dressed, you want to harm the baby or yourself, that's a problem, and you need to immediately contact a healthcare provider.
Another resource is Postpartum Support International. Also write that down. Look it up. There is a national hotline provided there. If you are just feeling really down, there is 24/7 support. This is contracted by the federal government to help you. So please reach out to that resource as well.
Exactly. On the next and final slide, here are just some other suggestions on resources. Your healthcare providers, those are people chosen by you. You trust them. Choose carefully and develop the relationship, and then always reach out to them. By phone call, by email, they're available to you, including lactation consultants. Reach out, share your concerns or your joys, or something just to check out. Parenting support groups, these are really important. I mentioned a breast friend before. I think that every woman deserves a breast friend, someone to talk to about the intimate changes happening in her breasts, talk to about how the baby's latch feels, talk to about increasing breast milk, decreasing breast milk, what kind of bra to wear, what kind of pump to use, etc. You want somebody who you can talk to all the time about all things breasts. It's really important. Parenting support groups are great. Group settings where you can gather with others, hopefully having similar situations. So others having your first baby, or if this is your sixth baby, talking to them. Your issues are different. Get those support groups going. Mom support groups are great. The United States Breastfeeding Committee has been mentioned as a really good resource. The Office of Women's Health, also a federal resource, is also very good. And because I think we dismiss our mental state so often, I point out this particular link to postpartum depression. It's really, really useful. And then local resources, check them out, including your local milk bank. You never know what resources you have in your area that might be able to help. I know here in Austin, we help healthy babies and their families figure out lactation and acquire donor human milk if it's just needed on a very small volume to get them through a very brief time period. And we also listen and hear what's going on with mom and then refer them to different resources. So check out your local resources. And with that, I just want to thank you for listening, for signing on, and for helping to grow the world's healthy community.
Oh, thank you so much. Wow, that was so amazing. Feel free to put in the chat, what was great here? I have a question. Ruby has a question. Do all jobs offer maternity leave?
So Ruby, I don't know where you're located, but in the United States, there is no mandated maternity leave. And so all jobs don't offer maternity leave. And so if you are a person considering pregnancy, it is very important to speak with your HR representative and find out what is offered in your position. Advocate for yourself and speak to the fact that you think that you need X time off and negotiate ahead of time. If there isn't time to do this ahead of time, contact the HR department, find out what is acceptable, and then you make the choices. You decide if that's the job of your dreams and you're going back to it, or this doesn't support your motherhood journey. Something different must happen. There are many, many different options.
I agree. Megan is also in Texas. I want to say this for you Texas folks. Our WIC program has a wonderful hotline. Please look it up. You can there's a lot, you can just call the line and they can answer a lot of questions. Her question was, is there maternity leave resources for self-employment in Texas? Kim, do you have any suggestions for reaching out to people on just maternity leave here in the state of Texas?
I do. So the Texas Department of Maternal Child Health.
Okay, great.
Is loaded with advocates who will inform you of the law and help you to figure out, based on where you are, where you can find local resources. I love that WIC, which stands for Women, Infant, and Children, was mentioned. There are multitudes of other resources here. So please reach out.
Wonderful. Anonymous asks, we live in a city where my husband's family lives as well. My family is in another country. I know they're going to want to visit ASAP at the hospital, but it seems because that seems to be the practice. I love them, but I know I'm going to be overwhelmed. How do I communicate this with my husband in advance? And the family.
You just communicated it with us.
Ugh.
Communicating in advance with your partner. This is how you feel. This is the great unknown of that immediate postpartum period. And this is the time for you and your partner and your baby to all bond together as you experience these multitudes of physical and emotional changes. Have that conversation and then offer a compromise. We all have cell phones. We all are able to FaceTime or interact in some similar way with people who can't be physically right there. I can guarantee you that you can speak with your provider and say, look, if I can't empower myself to just say no, will you say no for me? I can't tell you how many of my patients I have said, you know, I've listened to how they felt and listened to who wanted to come immediately and their discomfort with that. So I've spoken with those other people and said, you know, I actually prefer to work without an audience, and I need to work with your daughter, son, daughter-in-law, whoever it is, privately. And then once I send her home from the hospital or the birthing center, I really need her to have X number of days on her own. So let's set up a different way of communicating. And then tell me, how are you planning on helping once you are able to come and visit this young family? What foods are you making that they love? And how good are your laundry skills? So use your healthcare provider to advocate for you if it's hard for you to have that conversation.
I love that you said that. I did not know that. That is wonderful. Anonymous asks, when is it best to harvest colostrum? Is it true that it can induce labor?
So if you are stimulating your breast in advance of the labor and delivery experience, you can stimulate some mild contractions. You'll feel them. You'll feel them as the abdomen, your abdomen, getting firm. and you might feel baby move around more, but you're not going to stimulate labor. The onset of labor happens as a result of a number of hormones working together, and you stimulating your breasts to release a little bit of colostrum is not going to make that happen. I worried about this question about 10 years ago when the practice of stimulating breast milk in advance of the delivery first became popular. And then there were some studies, and the studies show that that's not going to stimulate labor. Those of you who are pregnant and at risk have identified risks for prenatal labor, you don't want to do that. We tell you as providers not to stimulate your breasts. But those of you who don't have those risk factors and who are at least 36 weeks pregnant, go ahead. You're going to be just fine.
Wonderful. Are you okay to take one more question?
Sure.
Okay. Maggie asks, my nursing midwife has not been very supportive, but I'm only a month or so away from my due date. I'm worried about not having the support I need for postpartum. Should I be looking for other doctors or just rely on my at-home support?
Your healthcare provider is very important throughout labor and delivery. If you have made a mistake and chosen someone whom you think is not going to be as supportive or supportive in the way that you need, and there's time to change, then yes, do it. But at 4 weeks before labor and delivery, I'd say that that is a very rare situation that you could build a relationship with a new provider that quickly. If there's another provider in the same practice, you might be able to switch quickly and have conversations with that new person very, very quickly, because we don't know when labor is going to start. But if you're at all feeling like your provider is not going to be the supportive person for you, think about who you're going to have from your personal life present and rely heavily on them. Communicate with them in advance and say, hey, I don't think that provider X is going to meet these particular needs. I need you to. Let's talk about what specifically you want from them. And so use them to fill in the gaps.
I love that. Well, thank you so much, everybody. I just put the link to our Facebook group here. We have a specific post for Kim, so please put your questions there. If you know anyone that has questions about postpartum that we may not have answered today, we invite you to join that group. Kim, what are your final words for our attendees today?
My final words are simple.
Yeah.
Give yourself some grace.
Mm-hmm.
You're all becoming mothers. You are all providing the next generation of people who will be amazing because you will be an amazing mother. And that doesn't mean that you're dressed clean or say the perfect thing. It means that you love and care compassionately and endlessly.
Oh, wow. Okay. I think we're going to end there, everybody. Thank you so much. We will send an email recap with all of this wonderful information. We'll share the winners in a couple days of our Postpartum Essentials kit. And thank you for joining us from Mom Cozy. Bye, everybody.
Bye, everyone.